second leading cause of death and the third leading cause of disability. And yet, most of us don't know enough about identifying or preventing it. To know more about stroke and its treatment options, we have with us today Dr. Anusha, neurologist at Apollo Specialty Hospitals, OMR. Good evening, doctor.
Good evening.
How do you identify a stroke?
So, what is stroke? Stroke is actually an acute neurological condition where the person may suddenly develop a weakness or a numbness or a difficulty in walking, balance issues. And there are two types of stroke. One is a ischemic stroke, and the other one is a hemorrhagic stroke. So, if you take the total number of strokes, 80% of strokes will be ischemic strokes, meaning that there is a blood clot in the brain, blood vessel, which limits the blood circulation to the affected part of the brain. And the other type of stroke, like what I said, has hemorrhagic stroke, that is due to the bursting of the blood vessel, and that also limits the entry of glucose and oxygen to the brain, thereby starving the brain and leads to neurological complaints.
How does stroke affect speech?
Yeah, so if you take brain, the brain has several centers. There are certain parts of the brain which are important for speech, certain part of the brain which is important for motor movements, certain parts of the brain which is important for sensations, certain for balance, vision, hearing. So when the part of the brain responsible for speech gets affected because of a lack of blood supply, either because of a clot or because of bleeding, that can affect the speech and may lead to speech difficulties. So even in the speech difficulties, there are two types of speech difficulty. One is a motor speech difficulty and a sensory speech difficulty, meaning that a motor speech difficulty doesn't allow the patient to speak fluently. Whereas in a sensory speech difficulty, what happens is a patient is not able to understand what the other person is saying, and neither is he able to communicate well to the person standing in front of him. And it may look like he's fluently speaking, but it may not be, it may not have any important information, or it may not be comprehensible.
Can stroke cause paralysis, doctor?
Yeah, stroke can cause paralysis. In fact, the Tamil word for stroke is pakkavadam, where one side of the body can become weak. And but paralysis is not the only thing which can happen with a stroke. Paralysis is the most obvious thing, the most important thing that the patient can recognize. But there are other types of strokes also, like we have a sensory stroke where there can be numbness of one side of the body, numbness of the face, and there can be the cerebellar stroke which can affect the balance. All the patient will notice is that he is struggling to balance. He may be walking like a drunkard, and he may not be able to walk in a straight line. So there are different types of stroke, but commonly what we as the common people are aware is a paralytic stroke.
Uh, there is a misconception that stroke patients cannot recover fully. Can you elaborate on that?
So the recovery from stroke depends on a lot of factors. So most important thing I would say in the current era is the time of presentation of stroke. So if the patient is able to present to the hospital immediately, and doctor is in a position to give a clot busting medication within 4.5 hours, there is definitely a possibility of reversing the stroke deficit. But supposing the patient comes to the hospital later, like after 2 or 3 days, then all the treatment would be aimed at to reduce the morbidity of the stroke and try to improve his condition. It is difficult to reverse stroke at that point. But definitely coming within 4.5 hours to the hospital will help them in recovering stroke. Nowadays, we have advanced modalities where up to 24 hours we can also remove the clot from the brain, and that is in selected individuals which the doctor will decide.
How can stroke patients reduce spasticity, doctor?
Yeah, so spasticity is one of the late sequelae, I would say, of stroke. Because of the brain damage sustained during the stroke, the part of the body which was involved in the stroke develops spasticity, meaning that there is a tightness of the muscles and there is an increased tone. So the most important thing for reducing spasticity would be physiotherapy. We also have certain medicines which can reduce the spasticity, and in some patients we can also give botulinum injection toxins into the spastic muscles, and that can reduce the spasticity.
Stroke is considered to be an NCD.
Yes.
Can you tell us a bit about it, please?
Yeah. So NCD meaning non-communicable disease. So stroke is one of the non-communicable diseases. The other non-communicable diseases are the myocardial infarction, that is the heart attack, diabetes, hypertension. So what do we mean by non-communicable? Non-communicable meaning that we don't really get it from another person. We develop because of our lifestyle. So the common risk factors for stroke are smoking, hypertension, diabetes, obesity, prolonged sitting, lack of physical activity, and we also have some non-modifiable risk factors like age. So males are more prone to develop stroke, whereas female are relatively protected from strokes during their menstruating period, that is between 15 years to 50 years. But once they cross the menopause, they have the same risk of developing stroke as men. And we also have some racial risk factors and genetic factors. Sometimes stroke runs in families, and those are all non-modifiable risk factors. But what we are more concerned about is the modifiable risk factors, so which we can reduce by incorporating healthy lifestyle habits in our life. So for that, we need to have regular exercise. We have to reduce our weight. We should go for regular medical screening for diseases like diabetes, hypertension, and modify our diet or take medicines to control it. And of course, avoid bad habits like smoking. The smoking is very harmful. It can lead to strokes and heart attacks. And I think one of the important factor for stroke in young people is smoking. So definitely it has to be stopped.
Speaking of young people smoking and lifestyle related issues, do we notice a higher incidence of younger people falling a prey to stroke these days?
Yeah, I can't really say I have some statistics about it, but lately we are seeing more number of young patients coming with stroke, even heart attacks, even like 30 years, they have a combined heart attack with myocardial infarction, meaning heart attack. So there can be many reasons for this. We all feel that lifestyle changes is the major factor, and the increased stress because of the fast life that is happening around nowadays, and also habits like smoking, alcohol, sedentary life, not having enough physical activity. It is recommended that we have at least 150 minutes of physical activity in a week to avoid all complications of these non-communicable diseases.
Do all stroke survivors have seizures after stroke, or who fall under the risk category of
Yeah.
getting seizures?
So seizures is definitely one of the long-term sequelae of stroke, but it isn't necessary that all of stroke patients would develop seizures in the future. But a certain percentage do develop seizures, and it is more cortical. It is more prevalent in those who have a particular location of the infarct in the brain. So cortical, which is more on the surface of the brain, is affected by stroke. Those can lead to seizures.
Are stroke and heart diseases related to each other, doctor?
Yeah, definitely. So, like I said, stroke is caused because of disruption of blood supply to the brain, and the ischemic strokes are because of a clot in the blood vessel, limiting the blood circulation, which is almost the same thing which happens in a heart attack. So, the pathology is the same, whereas the location of the clot is different, which makes it two different diseases. But if you go into the mechanism, it is pretty much the same for both heart attack and strokes. And the other aspect of this is that in patients who have heart diseases, they can develop strokes. So somebody who has got a heart problem can develop clot inside the heart, and that clot can break away and go to the brain and block the blood vessel of the brain and result in a stroke. Or heart problems can also lead to changes in the heart rate or the regularity of the heart beating, and that will also provoke strokes. So sometimes even heart attacks can lead to strokes.
You mentioned about risk factors earlier. What are the uncontrollable risk factors that increases the chances of having stroke?
Yeah, I told about rather than uncontrollable, I think we can talk more as modifiable and non-modifiable. The non-modifiable risk factors are age, which we can't really modify. The aging is a part of life, and the other risk factors are the sex. Like I said, the female sex can will be relatively protected during their reproductive years, and certain racial ethnicities also contribute to stroke and genetic factors. So generally, the genetic strokes are quite rare and they may present in the younger age groups, and generally they will be affected people in the family.
Can a patient completely recover from paralysis after a stroke?
Yeah, so recovery from stroke is multifactorial. If a patient presents to the hospital immediately, as in within half an hour, and they are able to do the neuroimaging, that is a CT scan and the MRI, and identify the stroke, identify whether it is from a small artery or in a large vessel, and plan the treatment. And if they can give a clot busting drug immediately within 4 hours, it is definitely possible to reduce the severity of the stroke.
Besides eating, besides eating seafood, generally there is an ideology that seafood causes stroke. Is
Yeah,
it true?
seafood doesn't cause stroke. Seafood is good in a lot of good cholesterol, and that can help with the limiting the cholesterol in the blood and the deposition in the arteries. So basically, stroke is caused. It's a vascular problem, meaning that it is a disease of the blood vessels, and this is because of the deposition of cholesterol, the atherogenic genesis in the blood vessels, and of course having good cholesterol will limit the deposition of cholesterol in the blood vessels and limit the possible future risk of stroke.
Do the signs and symptoms of stroke differ depending on the age of the patient?
I wouldn't say the signs and symptoms would differ dramatically, but yes, in younger children the stroke may not be very apparent. They may present with crying, or they may refuse to walk, and it is difficult to identify in young children. But in adults, pretty much the stroke is present just like how I've described earlier.
Um, how does stroke affect the lifestyle of a person?
Yeah, stroke is actually a devastating problem because it can lead to severe disability. And if it is a major stroke, the patient might be left with permanent paralysis lifelong. And in some cases, the stroke can lead to speech problems, and sometimes the speech does not recover completely, and the patient may have difficulty in speaking, and some patients may have difficulty in balancing. And but overall, stroke improves in general over time with good rehabilitation measures.
What can one do to prevent stroke, doctor?
Yeah. So to prevent stroke, we need to have we need to identify the risk factors, and go for periodic medical checkups and see if we have diabetes, hypertension, cholesterol issues, or we having lack of physical activity, and try to correct all this. And also take a healthy balanced diet, being stress free in life, and you can also do yoga meditation to reduce our stress, and all these things put together can help reduce the risk of stroke in us.
We have a question. What happens to a person's body when he is suffering from a stroke? Are there things that can be done by the patient himself as soon as he thinks he has been
If
affected?
you mean at home, I would say that the best possible thing the patient could do is to seek medical attention immediately. There is no particular first aid that can be done at home because, like I said, of the two strokes, one is a hemorrhagic stroke, and for conditions like heart attack, some patients do take aspirin before reaching the hospital, but that might be disastrous if they do that before a hemorrhagic stroke. So it would be preferable to start the treatment of stroke after confirming the absence of a bleeding in the brain.
What is a comprehensive stroke center?
Okay.
Apollo Specialty Hospital's OMR is a comprehensive stroke center. Can you tell us a bit about it?
Yeah, the comprehensive stroke center is generally where there is a team. So there will be a team, a well coordinated team with of the emergency, the ambulance, the ICU, the neurologist, the radiologist, the neurosurgeons. So whenever a stroke call is made, the immediately information will be disseminated to all the members of the stroke team, and everybody will come into the picture so that we can treat the patient immediately. And there will be specialized stroke nurses to take care of the patients, to meet the needs of the stroke patient.
What medical conditions increase the risk of a stroke?
So medical conditions which can increase the risk of stroke are heart diseases which limit the pumping of the heart diseases where there is a change in the rhythm of the heart beating, and other problems like diabetes, hypertension, cholesterol, high cholesterols, and even heart failure. So many other medical problems, even rheumatological conditions can lead to strokes, but that is out of the purview. I am just talking about the common medical conditions that can lead to stroke.
Hello, doctor. What should I do if I think someone is having a stroke at home, at office, on the road, or anywhere?
Yeah, the best thing would be to go to the hospital emergency immediately. You can call the hospital to let them know that you're on the way, and the whatever the all the immediate management will be taken care of by the stroke team.
Why? What is a mini stroke, doctor?
Yeah, mini stroke is something like a warning stroke. So, in a certain population of patients, they may have some warning even before they develop a full blown stroke. Many a time, the patients actually ignore these symptoms. Those symptoms will be more like a few transient or slurring of speech, or they can have a bicollateral, they can have a weakness in the arms, they can have a weakness in the legs, the tallatam while walking, balancing issues, or even vision problems. Suddenly for a few seconds or minutes they may have trouble with seeing one side of the visual field. So these are all warning symptoms of stroke, and these have to be taken very seriously. So even if they don't develop a full blown stroke, they need to come to the hospital immediately and get evaluated to see if they are having any medical problems or any heart issues which might make them develop a stroke in the coming weeks.
We have a question, doctor. What is GBS, Guillain-Barré syndrome,
Yeah.
and what can I do to prevent it?
Yeah, so Guillain-Barré syndrome is quite unrelated to stroke. Guillain-Barré syndrome is more of it is a generalized weakness of the arms and legs and face, and it is because of the loss of insulation of the nerve fibers throughout the body. So it is something related to the peripheral nerves, whereas stroke is something which is related to the brain and the spinal cord and the retina. And the stroke is more because of lack of blood supply, whereas here there is a antibody protection against the insulatory layer of peripheral nerves, and it is more of an autoimmune condition where the body fights its own blood cells. But both are unrelated actually, but both may present like weakness of all limbs. So that is why when you have symptoms like a stroke at home, it is advisable to come to the hospital so the doctor can actually examine you and determine if you're actually suffering from a stroke or it is something which looks like a stroke. So there's a lot of conditions like called as stroke mimics. Even following a seizure, you can develop a weakness of one side of the body, and you might think it's a stroke, but it might just be a post-seizure phenomenon which will improve by itself. So that will not need long-term management of stroke. And even patients with migraines and complicated migraines, they can also develop weakness of one side of the body. So these are all stroke mimics which can be identified only by the doctor. And the best thing you can do whenever you develop any weakness, balance issues, visual problems, or difficulty in talking is to go to the hospital immediately.
You mentioned about mini stroke earlier. What are the signs and symptoms that one should look out for?
Yeah, so we have this acronym called FAST, which is F is for facial drooping, A is for arm weakness, which also includes leg weakness, S is for speech difficulties, and T meaning the time. The time is very important. You have to reach the hospital on time so that you can be treated immediately. Lately, the acronym has been expanded to include the balance and eye symptoms also, and so now it is called as Be Fast. You be fast, you look for balance problems, you look for visual disturbances, you look for facial drooping, arm weakness, and speech difficulties, and go to the hospital as soon as possible.
The same person who's asked about GBS is asking about the treatment for GBS.
So, treatment for GBS is quite different from that of stroke. First, we'll have to identify, examine the patient, and see the patient come thoroughly to see if he's fitting into the GBS. And then we will have to do certain nerve conduction tests to see if how badly the nerves are affected or at what level they have been affected. And we'll also have to go for some specialized tests where we have to remove some fluid from around the spinal cord and test it for inflammatory changes or for infections. And the treatment is different, where we give an injection called intravenous immunoglobulin for about 5 days to improve the prognosis of GBS. In some individuals, we also go for a plasma exchange. It's called as plasmapheresis, which can also be done.
Can you tell us a bit about the surgical treatment for stroke, doctor?
Yeah. So, in general, when we talk about stroke, we are talking about ischemic strokes, but 1 by 5th of the strokes are hemorrhagic strokes. And in hemorrhagic strokes, it can be a stroke bleeding into the brain itself or surrounding the brain or in between the layers of the brain. So, when there is bleeding into the brain, in certain mostly it would be a medical management. Rarely the surgeon might come into the picture where evacuation of the bleeding into the brain can be done. And other condition is called a subarachnoid hemorrhage, where the neurosurgeon has a role, where there is a thinning in the blood vessel, and that thinning can sometimes burst and lead to a hemorrhage surrounding the brain, and it can have its own complications. So that is generally called as aneurysmal bleeding. The aneurysm is the weakening of the of part of the blood vessel, and that can be treated by clipping or by coiling, and so the neurosurgeons will come into the picture in these conditions. As far as ischemic stroke is concerned, where there is a very big stroke, where very big vessel has been affected, sometimes we may have to remove a part of the skull to ease the tension inside the brain. That's called as decompressive hemicraniectomy. So these are the conditions where we will have to seek the help of the surgeon in managing strokes. But in general, a stroke is managed medically.
What is the expected life expectancy after a brain stroke?
So that is quite variable. So if the patient had a minor stroke and he had recovered well, I wouldn't really think that his life expectancy would be affected much, unless he has other risk factors like heart problems, uncontrolled diabetes, uncontrolled hypertension, which can lead to further strokes or further vascular problems and affect his life expectancy. In the patients who have a major stroke and who are bedbound with disability, unable to walk around, definitely they are likely to have certain other complications like blood clots in the leg, which can ascend up to the lung and cause breathing problems. Or they can develop infections, they can develop complications of the stroke, and that might reduce their life expectancy. If we cross the initial part of the stroke, in general, stroke improves and the patient will not die of the stroke. He may have other problems which can reduce his life expectancy.
Are diabetic patients at a risk of getting stroke, doctor?
Definitely, diabetes is a very major risk factor of stroke. Reason being that diabetes affects the blood vessels of the entire body, not just the brain blood vessels. It affects the blood vessels of the heart, of the kidneys, of the nerves, So whenever there is a disease which can affect the blood vessels, then that can lead to strokes.
This month being Stroke Awareness Month, what would be your message to our viewers, Doctor?
Yeah, so the World Stroke Association this year has told that 1 in 4 of us will develop a stroke, so don't be the one.
Thank you very much for a wonderful and interesting session, Doctor. For appointments with Dr. Anusha, you may reach out to 7299099885. I repeat, 7299099985. Thank you very much, Doctor. Thank you, viewers.